Good afternoon, everyone. My name is Lean, and today Serena and I, both second-year medical students, will be presenting our research study titled Internal Stigma, a mixed method analysis of people living with HIV Stigma Index 2.0. This research was conducted in collaboration with the Centre for Positive Health Sciences here at the Royal College of Surgeons, under the mentorship of Dr. Elaine Byrne, with guidance from Nadine Ferris-France and Dr. Katrina Caher. Our study focuses on internal stigma, how people living with HIV internalize negative beliefs about their condition and its impact across different regions. This project allowed us to take a comprehensive look at how internal stigma influences the emotions, behaviors, and personal abilities of individuals living with HIV. Throughout the course of the research, Serena concentrated on the quantitative data, while I worked more closely with the qualitative aspects of the study. I will begin by providing some background on internal stigma and how we approach this study. After that, I will go into the emotional behavior impacts of internal stigma, while Serena will cover its effects on personal abilities and share the broader implications of our findings. Internal stigma refers to the negative attitudes and beliefs that people living with HIV may come to believe about themselves. These beliefs often stem from broader societal stigma, and over time, individuals may internalize these views, leading to feelings of guilt, shame, low self-esteem, and even self-isolation. This self-stigmatization creates barriers not only to emotional well-being, but also to effective HIV treatment and management. People who internalize stigma may be less likely to seek care or disclose their status to friends, family, or healthcare providers, which can limit their access to support and resources. The People Living with HIV Stigma Index was originally created as part of the greater involvement of people living with HIV and AIDS principle. This tool allows us to capture data about how stigma, both internal and external, affects people living with HIV. With this research, we aim to provide a clear picture of how stigma shapes the lives of people living with HIV globally. To address the complexity of internal stigma, we employed a mixed methods approach, blending quantitative data with qualitative narratives. The data from the study was collected from 40 country reports included in the People Living with HIV Stigma Index 2.0. These reports, which are publicly available, span across various languages, including English, French, and Spanish, offering a truly global perspective. The quantitative data was gathered from structured questionnaire responses within these reports. For this aspect, we analyzed proportions of yes responses to various questions, then categorized countries into low, medium, and high stigma groups using statistical quantile calculations. This allowed us to systemically measure and compare internal stigma across different regions. At the same time, we conducted a thematic analysis of the qualitative data. This involved reviewing personal narratives shared by people living with HIV, which gave us insights into lived experiences of those affected by internal stigma. By combining these methods, we were able to capture not just the statistical prevalence of stigma, but also the human experiences behind these numbers. This approach was crucial as it enabled us to see how internal stigma manifests differently across regions and within different cultural contexts. Starting by looking at the emotional impact of internal stigma, our data reveals significant variation in how stigma affects people emotionally, depending on where they live. On a global level, we found that 72.2% of participants reported difficulty disclosing their HIV status to others, and 70.5% admitted to hiding their status. These numbers indicate that internal stigma leads many people to conceal their HIV status, either out of fear of discrimination or due to feelings of shame. When we look more closely at the regional differences, we see that stigma plays out in distinct ways depending on cultural and social contexts. For example, the highest levels of difficulty in disclosing HIV status were recorded in Pakistan, where 71.9% of participants reported challenges with disclosure. In contrast, Botswana had the lowest percentage at 16.2%. This stark contrast highlights the influence of cultural norms and public attitudes towards HIV in different regions. On a regional scale, Southern Asia had the highest percentage of people experiencing difficulty in disclosing their status at 66.7%, while Western Europe recorded the lowest percentage with only 22%. These patterns align with global trends in the People Living with HIV Stigma Index from 2023, which suggests that stigma is partially pervasive in regions where HIV is more highly stigmatized by society. The qualitative data also brings these statistics to life. One participant from Ukraine shared, "I don't want to tell anyone or talk to anyone about it." While someone from Portugal reflected, "I hide my status. I don't think I've ever experienced discrimination." These narratives underscore the emotional burden of keeping one's HIV status hidden. Even in regions where external discrimination may be less prominent, the fear of stigma persists, causing individuals to remain silent about their condition. This emotional toll is universal. It doesn't just manifest in regions where with high stigma, but can also be found in areas with relatively low levels of external stigma. The weight of keeping such a personal aspect of one's life hidden can have a profound impact on mental health, leading to isolation, anxiety, and emotional distress.
Good afternoon, everyone. My name is Serena, and I'll be continuing on with the behavioral impacts of internal stigma, its effects on personal abilities, and the broader implications of it. So the data we gathered reveals that internal stigma affects more than just emotions. It also profoundly influences behavior. So our analysis found that 12.1% of respondents reported isolating themselves from family and friends due to their HIV status. This highlights how internal stigma can lead to a cycle of social withdrawal and loneliness. Because just imagine for a moment the emotional toll it takes on someone to feel so ashamed of their condition that they cut themselves from the people who love and care for them the most. And this is the invisible barrier that internal stigma creates. Additionally, 17.1% of participants reported avoiding sexual activity. This behavior is often driven by fear of rejection, fear of judgment, and sometimes even fear of accidentally disclosing their status to their partners. When we look at regional differences, we find that the highest levels of avoidance were recorded in Oceania, where 31% of respondents reported avoiding sexual activity, and in Northern Africa with 24.8%. Meanwhile, in Eastern Europe recorded the lowest levels with only 8.9%. These social discrepancies suggest that social and societal norms, as well as the availability of support services, play a significant role in how internal stigma manifests in behaviors. So the qualitative data also reinforced our findings. One respondent from Germany shared, "I haven't gone swimming for 20 years because I had the feeling that I didn't belong there." This powerful statement reflects the deep-seated fear of being judged or excluded from public spaces, a fear so strong that it causes people to avoid activities that they once enjoyed. Similarly, a participant from Portugal said, "I have withdrawn from my friends for fear that they would find out." This speaks to the profound anxiety surrounding disclosure, even to close friends. So we see how internal stigma doesn't just affect a person's mental health. It spills over their actions, influencing the way they interact with the world around them. Now let's explore how internal stigma affects personal abilities and self-perception. When we talk about personal abilities, we refer to how individuals view themselves, their skills, and their capacity to manage day-to-day challenges. Internal stigma often acts as a barrier, limiting people's potential and diminishing their sense of self-worth. So in our study, we found that 22.4% of individuals reported positive impacts on self-respect, with 24% stating that they had developed greater respect for others. While these numbers reflect some resilience among people living with HIV, they are still overshadowed by the negative impacts. For instance, 25% of respondents reported difficulties managing stress, and 25.2% said that their self-confidence had been negatively affected. These figures show that internal stigma not only impacts how people feel, but also how they cope with life challenges. It's not just a question of feeling ashamed or isolated. It's about not believing in one's ability to navigate life's difficulties. And for regional disparities, Central America reported the highest positive impacts on self-respect, with 38.5% of respondents noting that they had maintained or developed a stronger sense of self-respect. On the other hand, Eastern Europe reported the lowest at only 4.7%. The regional differences suggest that community and cultural factors play a significant role in how individuals internalize and respond to stigma. In regions where internal stigma is more prevalent, we see more profound negative effects. In Vietnam, for example, 28.6% of participants reported significant negative impacts on their personal abilities, particularly in areas like stress management and self-confidence. Through the qualitative data, we can hear powerful testimonials that reflect these struggles. One respondent from New Zealand shared, "Deciding who to trust becomes a significant challenge. This highlights the constant tension people living with HIV feel when navigating social relationships, unsure of how others will react to their status. And ultimately, these impacts on personal abilities can lead to self-isolation, a reduced quality of life, and avoidance of care, which can have long-term consequences on both individual and public health." So coming towards the end of the presentation, it's important to reflect on the key findings we've discussed and their broader implications. What we've seen from our research is that internal stigma has a profound and multifaceted impact on the lives of people living with HIV, affecting their emotions, behaviors, and personal abilities. In regions like Southern Asia and Western Africa, where internal stigma is higher, the negative impacts are more pronounced. Individuals in these regions face greater challenges in disclosing their status, avoiding social and sexual relationships, and struggling with feelings of guilt and self-blame. These findings suggest that targeted interventions are necessary to reduce internal stigma and improve the well-being of people living with HIV in these areas. Conversely, regions like Western Europe, which reported lower levels of internal stigma, saw fewer negative outcomes. This indicates that efforts to reduce stigma, whether through public health campaigns, support groups, or legal protections, can make a tangible difference in the lives of people living with HIV. So in summary, reducing internal stigma must be a priority for public health efforts, particularly in areas where burden is the highest. When people living with HIV feel supported and accepted, they are more likely to engage in care, adhere to treatment, and maintain healthier lives. This not only improves individual outcomes, but also benefits communities by reducing the transmission of HIV and fostering more inclusive societies. And before I close, I would like to take a moment to acknowledge the generous support of the RCSI Research Summer School Program, which made this research possible. Thank you very much.